good day mga kabeshi, mga kapanga! Kamusta po kayong lahat dyan? I really hope that you're all doing well and welcome back to my YouTube channel. Today, I will share with you my top 10 test-taking strategies on how to pass NCLEX with just 1 month of preparation, self-review, and using 2 resources. First is the Saunders Comprehensive Book, and second is the Prioritization by La Charity. Are you excited? Are you excited to ace your exam and finish your NCLEX with only just 75 questions? But before that, don't forget to hit like and subscribe. For our first strategy, I will tell you the difference between active and passive studying. Active studying means you are engaged in your study materials. Guys, sobrang dami ng libreng materials ngayon and reviewers, and minsan yung iba binabayaran pa rin natin, pero you have to utilize your own study material and use it effectively. For example, sa passive studying, you are just copying notes as they are written. Sa active studying naman, you are rewriting your notes in your own words. Therefore, mas familiarize ka sa medical abbreviations and vocabulary na ginagamit dun sa review materials mo. In addition to that, sa passive studying, you are just sticking to one study method. Unlike sa active studying, you are using more than one method of learning, may it be audio or visual cards. Another example, sa passive studying, you are just memorizing, but there's a probability na walang comprehension, meaning mas increase yung chance na makakalimutan mo rin yan. But with active studying, you are explaining it to somebody else, meaning you are teaching it to somebody like your partner, your colleague, or your coworker. Mas increase yung chance na talagang mariretain mo kasi naituro mo na. Second strategy, use mnemonics. First, MONA, morphine, oxygen, nitroglycerin, and aspirin. This abbreviation is a standard initial treatment approach for all patients presenting with chest pain due to suspected myocardial ischemia or myocardial infarction. Bongga! Next mnemonic, ZZLSD. These drugs are used in the treatment of HIV. Z stands for zidovudine, next zalcitabine, next lamivudine, and last but not the least, stavudine and didanosine. O, di ba? ZZLSD na lang para hindi nyo makalimutan. Next mnemonic, Mad Dog. MADDDOG. This is the treatment for patients with congestive heart failure. M stands for morphine, A aminophylline, D digoxin, D dopamine, D diuretics, O oxygen, and last but not the least, G for gases. Gases is for monitoring the arterial blood gases or ABG. Third strategy, recognition versus active recall. Answering multiple choice questions is also a great way to practice and pass the NCLEX. And through this, you are using the recognition technique. For example, kapag may tanong about kung ano yung medication na nakakapag-decrease ng fever, alam mo na agad yung sagot kahit 4 choices pa yan. But with active recall, you need to revise the question. Instead, you will ask yourself, what medication can be used to treat a fever? Therefore, this is a far more reliable way to test if you know something or not. For our fourth strategy, always remember that you need to prioritize. You will be able to recognize the priority questions in the NCLEX exam because they will ask you about the most important thing, the first thing to do, the initial response, and also what is the best thing to do. If you found those keywords, then the prioritization is the key. And kapag alam mong mag-prioritize, dyan naman dapat pumasok at dapat mo ring i-practice ang nursing process. ADPIE, or assessment, diagnosis, planning, implementation, and evaluation, plus the principle of ABC: airway, breathing, and circulation. Let's take a look at this sample question. An hour after admission to the nursery, the nurse observes a newborn baby having spontaneous jerky movements of the limbs. The infant's mother had gestational diabetes mellitus or GDM during pregnancy. Which of the following actions should the nurse take first? First, give dextrose water. Second, call the physician immediately. Third, determine the blood glucose level. And fourth, observe closely for other symptoms. In this question, you probably recognize the baby's jerky movements as an indication of hypoglycemia. Diyan papasok yung nursing process, or the first step is assessment. But don't forget that the most important part of an assessment is validating what you observe. Indeed, you must complete an assessment before you analyze, plan, and implement nursing care. Therefore, the first thing that you need to do is number three: determine the blood glucose level. Fifth strategy: always follow the Maslow's hierarchy of needs. And with that, Maslow identifies five human level needs. With the first level, that is physiological. Next is safety or security. Next, love and belonging. For the fourth level, that is self esteem. And last but not the least, self actualization. And because physiological needs are necessary for survival, they have the highest priority and must be met first. Physiological needs include oxygen, fluid, nutrition, temperature, illumination, shelter, rest, and sex. Therefore, if you don't have any oxygen to breathe or food to eat, you don't really care about having a stable psychosocial relationship anyway. Let's take a look at this example. The nurse obtains a diet history from a pregnant 16-year-old girl. The girl tells the nurse that her typical daily diet includes cereal and milk for breakfast, pizza and soda for lunch, and a cheeseburger, milkshake, fries, and salad for dinner. Which of the following is the most accurate nursing diagnosis based on this data? First, altered nutrition, more than body requirements related to high fat intake. Second, knowledge deficit, nutrition in pregnancy. Third, altered nutrition, less than body requirements related to increased nutritional demands of pregnancy. And fourth, risk for injury, fetal malnutrition related to poor maternal diet. The first thing you should notice about this question is the phrase most accurate, meaning there is a possibility that there is more than one answer that could be considered correct. And be careful with those kind of questions because these are the tricky ones. How to answer this question? Step 1: look at the choices. You will see both physical and psychosocial interventions are included. Step 2: eliminate all psychosocial answer choices. So sa number 2 na choice, knowledge deficit, nutrition in pregnancy. So you can eliminate that one because that is a psychosocial issue. Third step, ask yourself whether the remaining choices make sense. Sa first choice, makikita nyo, altered nutrition, more than body requirements related to high fat intake. This actually makes sense because enough naman yung kinakain ng bata. Pangalawa, dun sa third option, altered nutrition, less than body requirements related to increased nutritional demands of pregnancy also makes sense. Dahil yung diet niya may adequate number of calories naman, but it is actually deficient in the needed vitamins and minerals. So, pwede rin. And last but not the least, option number 4. Risk for injury, fetal malnutrition related to poor maternal diet. Actually, it does not make sense because there is an adequate number of calories naman to support the fetal growth of the 16-year-old teenager. So, eliminate that option. So in this matter, you only have two options left, 1 and 3, and you will actually observe that they are kind of contradictory with each other. Guys, tip lang, kapag meron na kayo nakita na two contradictory choices, malamang sa malamang, isa na doon ang tamang sagot. In this question, may two choices ka na lang. Either yung number one na maraming fat and yung number three na kulang sa nutrients. And based on Maslow's hierarchy of needs, the correct option is number three. Mas higher yung priority natin dun sa patient na hindi na masyado nakaka-receive ng nutrients. Therefore, altered nutrition, less than body requirements related to increased nutritional demands of pregnancy is the best answer. For our sixth strategy, know the difference between assessment and implementation. I know sinabi ko sa inyo na you will always have to follow ADPI or assessment before the implementation, but not all the time. And when is the best time to use implementation over assessment? Let's take a look at this question. A boy was riding his bike to school when he hit the curb. He fell and hurt his leg. The school nurse was called and found him alert and conscious, but in severe pain, with a possible fracture of the right femur. Which of the following is the first action that the nurse should take? First, immobilize the affected limb with a splint and ask him not to move. 2. Make a thorough assessment of the circumstances surrounding the accident. Third, put him in semi-Fowler's position for comfort. And fourth, check the pedal pulse and blanching sign in both legs. How to answer this kind of question? First step, look at the choices. Kung mapapansin nyo, mix siya ng parang assessment or validation and implementation. Diyan papasok yung step 2. Refer to the question to determine whether you need to assess or to implement something. And according to the question, the nurse has determined that there is a possible fracture, meaning the assessment or initial validation has been made. And if the nurse completed the assessment process, it is now the best time to implement. Step 3. Eliminate the other choices and choose the best answer. First, eliminate answer 2 and 4 because they are assessment. 2 is make a thorough assessment and number 4, check the pedal pulse. So, syempre, hindi na dapat yung gawin. This leaves you with choices 1 and 3. Which takes priority, immobilizing the affected limb or placing the boy in a semi-Fowler's position to facilitate breathing? So the question does not indicate any respiratory distress. Therefore, the correct answer is number 1, immobilize the affected limb. This is a very tricky question kasi kung iisipin nyo, na-mention ko kanina yung priority ng airway, breathing, and circulation. And dun sa option ng number 3, put him in semi-Fowler's position for comfort. Always go back with the situation. Wala naman pong na-mention about difficulty of breathing. So you have to implement the best nursing action right away, which is to immobilize the suspected fracture to prevent further complication. And kung iisipin nyo yung principle ng ABC without looking at the context of the situation, mali na yung masasagot nyo kasi ang na-prioritize nyo ay breathing. And always be careful with those kind of situations. For our seventh strategy, always ensure the safety of your patient. Safety includes meeting the basic needs and also reducing hazards that cause injury to the patient. And why is also safety one of the most important criteria when you are taking the NCLEX? It is for the reason that NCLEX is a test of minimum competency to determine that you are able to practice safe and effective nursing care. So always think that safety should also be considered when selecting answers on the exam. And to determine the safety of the client, let us answer this question. A child undergoes a tonsillectomy for treatment of chronic tonsillitis unresponsive to antibiotic therapy. After surgery, the child is brought to the recovery room. Which of the following actions should the nurse include in the child's plan of care? First, institute measures to minimize crying. Second, perform postural drainage every 2 hours. Third, cough and deep breath every hour. And fourth, give ice cream as tolerated. In this type of question, you can also apply the other strategy that I have mentioned before, which is recognition versus active recall. Actually, in this kind of question, parang medyo complex siya and overwhelming yung choices. But I will help you to answer it correctly. Step 1, rephrase the question. What should you do after a tonsillectomy? Are all the answer choices implementations? Of course, it is a yes. Step 2, can you answer the question with your knowledge of a tonsillectomy? May mga sasagot ng yes, may mga sasagot din ng no. But on the safe side, let us just answer no. Step 3, ask yourself this question. What will cause the client the least amount of harm? With the first option, institute measures to minimize crying. Pwede because if you will minimize the crying episode of the patient, it will help prevent bleeding. So consider that option. Second option, postural drainage. So postural drainage, alam naman nating lahat yan, it may also cause further bleeding. So eliminate that option right away. Third option, cough and deep breathing exercises. So actually, it will only just increase the pressure in the intrathoracic area, which will cause further bleeding. So eliminate. And last but not the least, give ice cream as tolerated. But it may look like a good sample to practice empathy to the patient, but in this situation, it will only give the patient the chance to clear his throat. Therefore, it will also cause bleeding. So eliminate choices 2, 3, 4, and choose the best option, which is number 1. Institute measures to minimize crying. Sa tonsillectomy, ang pinakamalaking consideration naman talaga is to prevent post-operative bleeding or hemorrhage. That's the reason why we are choosing the option number 1, to minimize the crying episodes, because crying would irritate the child's throat and increase the chance of hemorrhage. For our eighth strategy, how to handle select all that apply questions. With this type of question, carefully look at each choice and eliminate wrong answers. But the problem is this: what if you don't have any idea at all? Therefore, you have to take a look at each option and answer it if it's true or false. Or you can eliminate incorrect options this way. Is the answer true to the question being asked, or is it false? And for our second to the last strategy, don't draw from past clinical or work experiences. Guys, past is past. Kalimutan mo na siya. Alam ko marami na sa atin ang naging staff nurse and nag-work naman talaga sa malalaki at maliliit na hospital. And we have been working for a very long time, even before we decided to take the NCLEX. But you must always take note that those experience shouldn't cloud your ability to answer test questions. Always remember that NCLEX is based on proven, evidence-based practice and research-based approach. Do not assume that this can also apply to the NCLEX. And even if your facility does something in a different way that is just as safe or just as correct, do not assume this does not apply to NCLEX at all. Mas mabuti ng safe, mas okay na parang wala ka na lang experience in the past at para hindi ka mahirapan sumagot ng NCLEX in an objective manner. And before I give you my last test-taking strategy, syempre, don't forget to hit like and subscribe! And for our last strategy, guys, ito po talaga yung pinaka-importante sa akin. Sobrang ang dami kong nakikita na nakakapasa ng NCLEX and they always mention to pray hard. Actually, sobrang taas ng stress and anxiety ko before taking the exam. I felt like hindi ako makakapasa kasi nga nag-self-review lang ako, tapos limited lang yung resources ko. Yung tipong wala talaga akong believe sa sarili ko. But when you are taking time to pray, before and after studying, talaga namang magkakaroon ka ng ibang perspective in your life. Siyempre, tanungin mo muna si Lord kung ito ba talaga yung will niya para sa atin. Kung hindi ka makakapasa, Lord, give me an alternative option. Buhayin niyo, Lord, yung confidence ko para makapag-retake ulit. And kung makakapasa ako, Lord, bigyan niyo ako ng magandang career after this. So guys, it's really important to pray, believe in yourself. Preparing for NCLEX is a very, very long journey. I felt like nung nag-aantay ako ng resulta ko, parang yun na ata yung pinakamatagal na 3 days talagang inantay ko talagang umiyak talaga ako noon. Sobrang after the exam. Feeling ko, nagsayang ako ng worth more than 60,000 sa pag-prepare. Pero walang imposible guys. Because He is the one in control of everything. And if this is His will, then nothing is absolutely impossible. Yun lamang guys. I hope marami kayong natutunan dito sa test taking strategies na na-share ko sa inyo para maipasa nyo ang NCLEX. Maraming salamat po sa panonood ng vlog nito. Good luck guys sa mga magte-test very soon and early next year. Malaki ang tiwala ko sa inyo guys and alam ko na mas marami pa kayong resources sa akin but don't forget to share it to others as well. And if you pass the NCLEX, be a blessing to other people, especially your co-workers or colleagues na gusto na rin mag-abroad. Guys, tulungan lang tayo and makakamit natin ang ating dreams. Yun lamang po. See you all on my next vlog. Take care and God bless you all!